Hello friends, myself Dr. Himani Prajapati and I'm assistant professor at LG Institute of Physiotherapy. Today we are going to talk about approaches to neuro rehabilitation, right? So the basic difference we are going to talk about, that is the difference between the neurophysiological and the system based approach. So the four approaches comes under the category of neurophysiological approaches, that are the Bobath, PNF, Roots and Brainstorm. The two remaining, that is the MRP and task oriented, comes under the category of system based approach, right? So what is the difference between the neurophysiological and the system based task related approaches? So first point will be based on the models of motor control, that based upon this concept how they differ to each other. The first will be in neurophysiological, I'll consider that first will be the reflex hierarchical system, right? So movements, for any movement to be carried out, there should be a sufficient sensory input, or that should be a central program elicitation, right? So that is mandatory for any movement to be carried out if we talk about the neurophysiological approach. Second is they follow the open loop as well as the closed loop motor controls, right? Third point, that is feedback and feed forward. This both influence the movements in the neurophysiological approaches, right? So the two most important part of any movement, if we consider, that are the feedback and feed forward. So this approach is utilizing two main mechanism of movement. Fourth is CNS is hierarchically organized with higher centrals, that is a CNS, that is a cerebral cortex, controlling the lower centers. And final is reciprocal innervation is essential for coordinated movement. So while the agonist is contracting, the antagonist must be relaxed. That is, a reciprocal innervation is essential for coordinated movement. If we talk about the system-based approach, then the first principle is the movements are organized by the functional needs or goals. So in this category, in this approach, there is not a mandatory that the sensory input should be present. If the goal is basically about the necessary function, then the movements will be organized. Second point, movement emerges from the interaction of many systems like neuromuscular, musculoskeletal, and all the systems are working together to produce movement. Third is systems are dynamically self-organizing and they are heterarchical. So the which is contradictory to the neurophysiological approach, which is hierarchically organized, right? So system based they arrange in a heterarchical manner, and the preferred movement pattern is the most efficient to achieve the functional goal. So here the preferred movement pattern is considered to be the most important. So if to carry out a functional goal, the patient or the norm or the human will follow the pattern which is the most preferred pattern for the given action. Next will be changes in one or more systems can alter the behavior. For example, if the CNS is intact but the musculoskeletal system is not working properly, then the because of musculoskeletal impairment, the action might be suffer. So changes in one or more systems can alter the behavior. Uh, Next, here you can see the neuromaturational theory, which shows that the cortex, uh, the neuroanatomical structures, if we see here, these are the cortex, midbrain, and brainstem, and spinal cord, right? The If we talk about the postural reflex development and the motor development, so cortex is responsible for the equilibrium reactions, right? Midbrain, that is a writing reaction, is it carried out. Brainstem and spinal cord, the primitive reflex pattern it will be carried out. So if we look at the movement, that is the motor development, how the cortex uh, is helping for this development is, if the cortex is fully matured, then only the bipedal function will be able to carry it out. If the midbrain is active, at that time the quadrupedal function will be activated. And if the brainstem and spinal cord are active, at that time the apedal function, means only the supine or prone lying activities will be carried out. So here you can see this is a normal motor development, right? So these are the important point that we have to consider, that how this neuroanatomical structures is related to postural reflex development, and how this development is related to the motor development, right? This is a top-down approach, that is a hierarchical control. That is a top-down approach. If we talk about the system-based approach, it can be down-top approach or it can be heterarchical also, right? So now next point. Now theories of motor development. So this will be the second point on which we'll differentiate the neurophysiological and system-based approach. So neuromaturation systems, the changes are due to the CNS maturation. So the reflex activity, the primitive, see in the development, the primitive reflex will come first. Later on, it will be dominated by the brainstem reflexes, and later on, it will be dominated by the cortical reflexes. So this is the change, is known as, that is the changes are due to the CNS maturation. Second point, that is development follows a predictable sequence, that is from cephalocaudal or proximal to distal, right? So in management also we are looking for the same thing, that is a cephalocaudal or the proximal to distal. Well, if it is a system based approach, then progression varies, because the main two important point that we have to consider in the system based approach are the first will be the person and the environmental context. So if the environmental context are different, then the rehabilitation will be different for each individual, right? So this doesn't follow the predictable sequence pattern which is followed in the neuromaturational systems. And last point will be CNS damage leads to regression to lower levels and more stereotypical behaviors. So if we talk about stroke, so when the stroke occurs, the CNS, that is the cerebral cortex got damaged. So what happens is we are able to elicit the pathological reflex if we talk about the ATNR, that is the asymmetrical tonic neck reflexes, or so this are the primitive reflexes, which, and also these are the stereotypical behaviors, means the synergic pattern, the obligatory synergy will emerge and will emerge in these patients, right? So this is the important point, that CNS damage leads to regression to lower levels and more stereotypical behaviors, right? And in this system, if we talk about, then the CNS leads to attempts to use remaining resources to achieve the functional goals. So the in this approach, they suggest that it is not that the CNS will again go to the stereotypical, but they will try to use the remaining sources possible, right? So in this case, if we talk about the neuromaturation system, then we mostly work on the obligatory synergy pattern. We work on the breakdown of the synergy, abnormal synergy pattern. So this we are working on the neuromaturational system. But if we are using a motor relearning program or task oriented approach, then we are using the remaining sources which is possible to use and to achieve the functional goals, right? This is just a basic, there are the two main differences, the basic concept are still left, but this is how the difference is based on the motor development and the motor control, right? I hope you all understand. And here are the references, that is Trombley, William Pedretti, Darcy and Champey Cook. uh, we'll continue with the part 2 of this lecture